Alright, so we're going to go over the cervical myelopathy cluster. This is a group of signs and symptoms that would indicate compression of the spinal cord in the cervical region. So a patient where we would actually go through these on would present with neck pain, decreased range of motion, and just stiffness in their neck. They might also mention difficulty with walking, like tripping or decreased sensation in their lower extremities. So the first thing that we'd want to check is your age. So Charlie, how old are you?
60.
60, you're looking pretty good for 60. So that would be a positive sign for the age. We're looking for over 45. And the second thing would be looking for some sort of a gait deviation. So Charlie, I'll have you walk for me and we'll just watch you walk. So we're seeing a little something going on there, so there would be a positive finding as well. So then the next thing we're looking for is the inverted supinator. So Charlie, I'll just have you rest your arm in mine here. And we'll find that brachioradialis and hit that. Oh, there we go. So that's the normal. A positive sign would be some motion like this or this, but that looks pretty good for you. So then the next is the Hoffman. So I'm just gonna hold Charlie's hand here and flick his middle finger here. So a positive sign would be him bringing his index finger and thumb together there. Perfect. All right, so then the last one here is the Babinski's. So for this, obviously Charlie's gonna take his shoe and sock off here, and then I'm just gonna use the back of the reflex hammer and go up from heel to toe on the lateral side of his foot. And he curled his toes a little bit. A positive sign would be him going into extension with his toes. So we're looking for 3 out of those 5 being positive findings. That would indicate that we would need to refer. Yeah.
All right, so the next test we're gonna do is the fulcrum test. And so what this is a test to just see if there's a suspected stress fracture. And to do this, we're going to take one arm and put it under the suspected stress fracture leg. And we're basically just making a nice fulcrum here, or a lever to push over. And so I'm gonna put some pressure down on the distal femur, and we're gonna see if the patient has any pain with that. Wherever the suspected fracture may be, we can also adjust the lever arm, so I can put it closer or further away, and then press again. And a positive sign or a positive test would be if the patient has pain with that, then we'd want to refer them to their primary care physician.
All right, so we're gonna go over the obturator and psoas test. So this would be used if you have a patient that comes in complaining of pain in their abdomen and or their hip, and it's used to rule in or out whether the origin is musculoskeletal or if there is the presence of like an infection or an abscess. So the first one, the obturator test, I'm just gonna lift up your leg here, Charlie, and passively rotate you out and back in. And do you have any pain with that?
No.
No, so that would not indicate anything more than just musculoskeletal problem. A positive finding would be pain in that passive range. Next, I'm just gonna passively bring, this is the psoas test, passively bring your leg into hip flexion. Any pain with that, Charlie?
No.
No. And then I'm just gonna have you do the same thing, just a straight leg raise on your own to actually activate the muscle. Go ahead and relax. How did that feel?
Fine.
Okay. So a positive finding for that would have been the presence of pain in that passive range once again. The other thing I can do real quick, Charlie, if you could lift your shirt, I can just palpate the psoas going between the ASIS and the belly button here. And I'll have you lift your leg and do a straight leg raise again. Go ahead and relax. How'd that feel?
Fine.
Fine. All right, so there I'm just palpating the psoas to kind of feel once it's activated if there is the presence of an abscess or anything that feels abnormal. And if there were any positive findings with this, we would just want to have the patient go and see their primary physician to get it checked out further. All right, so now we're going to go over the olecranon manubrium screen. So this we would use on patients who have suffered some kind of a shoulder trauma, and they've complained of the constant ache, pain at night, the common signs of like a fracture or dislocation. So what we'll do for that is, Charlie, if you don't mind taking your shirt off here. And then I'll have you cross your arms so then both your olecranon are exposed as well. And what I'm gonna do here is I'm gonna take this stethoscope and place the bell on the manubrium. And then tap on the olecranon on each side. And what I'm looking for is just a crisp and clear sound on both sides, which would indicate nothing kind of interrupting that sound coming through. If the affected side was more of a dull, interrupted sound, it could indicate dislocation in the shoulder, fracture, and then we would want to refer to the primary physician for further evaluation.
Alright, so next we're going to do a test called the patellopubic percussion screen, and what that's going to test for is a suspected hip fracture or a suspected SCFE. And so what we're going to do is we're going to place the bell of the stethoscope just lateral on the pubic bone, just lateral to the pubic symphysis, okay? So Matt, is it alright if I do some palpations in your lower hip area?
Yeah.
Okay. So I'm finding the pubic bone, and I'm going to explain to the patient, this is where I want you to put the stethoscope, okay? But I want you to do it just a few inches lateral to this, okay?
Okay.
Okay. So I'm going to have the patient put that underneath their shorts, just lateral, still on the pubic bone, and I'm going to apply a tapping force to the patella on the ipsilateral side. Okay. And if you could move it to the other side now. So what I'm doing here is I'm just listening for a clear, crisp sound. If I hear any dullness or anything like that from one side to the other, then that's a good indication that there may be a suspected fracture or a SCFE, and we would want to refer them to their physician for further investigation.